The Prime Minister has said on multiple occasions that he is happy to talk to premiers about the Canada Health Transfer. In fact, we're finalizing in the next little while a time this fall to have that very meeting.
Canada's premiers want $70 billion for health care. Will they get it? And what happens if they don't? Manitoba Premier Brian Pallister is with us now. He's here in Ottawa. Welcome to Power Play, Premier. It's very nice to see you as usual. I want to ask you this. Last week, François Legault and Doug Ford met. This week, you and Alberta's Jason Kenney are joining in person. It was described to me as a stunt by the premiers a few days before the throne speech, a little bit of pressure on Ottawa. Is this a stunt? Because you talk to the Prime Minister regularly, you talk to each other regularly. So why do this in person on a Friday?
Well, Joyce, I think we all know people who are affected directly by delays in our healthcare services. We know the numbers from the last 20 years. Our wait times in almost every category are double, triple what they were. We know that the demand for services is growing very steadily. And we know that COVID has made all of this much more apparent to everyone. So what we're here to do is to ensure that we can have a genuine partner in the federal government and we can work together to restore the foundation truly of our social network in this country, which is our Medicare system, so that people can get the services they need when they need them. And Ottawa's level of support is the lowest it's been since the Canada Health Act was passed. So we need that commitment. And I would say focusing on the fundamentals is what our job is as elected officials, and that's exactly what we did today with our efforts to promote healthcare in this country.
So right now the health care is $42 billion, transfer from Ottawa is $42 billion. You're asking for $70 billion. How did you get to that figure, and what happens if Ottawa says no?
Well, what happens, of course, Joyce, is that what's been happening will continue and worsen. And what's been happening is that demand has risen while federal support has dropped, equaling longer waits. And we know that anyone out there who hasn't been affected by this knows someone who has been. We know that those delays cause pain for people. We know those delays cause fear for people. And we know those impacts are very real and they're very human impacts. We also know that our estimates from the Conference Board of Canada on just the first 90 days of COVID tell us that we have, in addition to the pre-existing waits, we have another 300,000 estimated Canadians that can be added to the list of people waiting for diagnostic testing or for surgery. This means that we have to address this issue. It's a long-standing issue. It's not a partisan issue. We haven't chosen as premiers to make it one. We've chosen to make it our top priority. Restoring the federal government's rightful role as real partners in healthcare is a worthy and important thing for us to focus on. And we sincerely hope that the federal government will accept that responsibility and demonstrate it with the throne speech next week.
Premier, you and I have met at several of your premier's conferences, and I remember this being your #1 priority even before COVID, saying that, you know, the federal government is shirking its responsibilities, went from paying 50% to 22% now as the population ages, as the cost for healthcare increase by 6% every year. So you have been making this case to Ottawa for years. I'm wondering, are you confident that this time they'll listen?
I'm hopeful. I've seen a willingness to listen on the part of the federal government. I have commented on that favorably, and I'll continue to, but I must say, listening and acting are not always the same thing. Next week's throne speech is an opportunity for the government to demonstrate that it's willing to focus on what matters most to Canadians. And what matters most to Canadian families is that they get the healthcare support for themselves and their loved ones when they need it, not months later, not years later, but rather when they need it. And we recognize that COVID has made this challenge even greater. We thank the federal government for its temporary supports thus far, but we recognize that we must face this challenge together. And the provincial governments have been doing that on the front lines, and that's why we continue to be unanimous in saying, from all political parties represented at the provincial level, that this is and must remain the top priority for Canadians, and it's been unaddressed by this government and by previous governments for too long. It needs to be addressed now.
So let me ask you this. If indeed the federal government were to give you what you want, that increase you want, do you guarantee that you won't decrease your funding for health care as well? That yours will remain stable and increase as well?
That's a guarantee I can make, absolutely. I won't speak on behalf of all other premiers, but I know, Joyce, and you know, that the provincial governments have stepped up, that they've raised their contributions dramatically over the last number of years on health care, and that we are going to continue to address it at the provincial level as our number one priority, I think is something I can guarantee. That being said, look, we have to focus on the foundation. Ask yourself, if you have a house that has a foundation that's eroding, do you redecorate the second floor sitting room? No, you focus on that foundation and you make sure that it works, and that's what the Canadian House needs right now. It needs that focus on the foundational repairs to our healthcare system that have been long ignored and can be ignored no longer.
Manitoba Premier Brian Pallister, thank you so much for taking the time to talk to us. I know you're busy, and safe travels back home.
Thanks so much, Joyce. Always a pleasure.